Hello, I'm Elena Bertozzi. I'm a physiotherapist specializing in pelvic floor rehabilitation. I'm author of several scientific articles, university professor, trainer. I will tell you about the treatment of very pelvic dysfunction with oxygenal therapy. I'm speaking about vulvar vestibulitis and oxygenal therapy. Vestibulitis is a pathology that I see very frequently, especially in young patients. For this reason, I decided to undertake this study with a new non-invasive and non-pain therapeutic approach with oxygenal therapy. We know well what boiled clothes is in an inflammation of the tissue surrounding the vaginal entrance. The causes are not yet well known. Sorry, that is a disorder of the immune system in general. We have the associated pathologies that contributing in these causes of vestibulitis. For example, reflex contraction of the pelvic muscles, and I see this situation a lot in my young patients. For example, in a young sport woman. Overstimulation of the nerve, chronic or recurring infections, microtrauma associated. Another most important causes is hyperactive cell. We know mast cell, the immune cell system. I think that is very important for this pathology. We know the effect of mast cell not only produce the inflammatory substances responsible for the erythema and irritation, but are also responsible for the activation of the nerve growth factor. The causes are repeated inflammation from infection, for example, Candida, Gardnerella, or Escherichia coli, microtraumas, and lifestyle. In fact, in our treatment, it's very important to explain our patient the correct lifestyle, the correct washing, intimate washing, the correct wash after sex, for example, for prevention the infection. A very significant condition for the rehabilitation process, which I often find in my patient, is pelvic floor hypertonic. This can itself be the cause of vestibulitis. The manifestation of vestibulitis is the redness of the mucous membranes of the vulvar vestibuli, dyspareunia, burning, lesion, and redness in general. The diagnosis of vestibulitis, I think that is very difficult because we have only the symptoms that our patient explain us. In fact, we don't have a real exam, but we have the symptoms and the anamnesis of our patient. The symptoms like dyspareunia, pelvic pain during the day, after sport, for example. We have one test we call swab test. This test is positive when if we touch with a cotton the vestibulo, the patient have pain. There is allodynia. We can propose to our patient different type of treatment. And another part of our treatment is the good instruction for daily life. For example, a correct hygiene, lifestyle education, use of correct systemic drug, type of analgesic like amitriptyline, gabapentin. I think that is very important that psychotherapy and sex therapy, because these young women are very scream of sex and the pain of during sex and after sex. In association, in particular for the hypertonic condition, is very important physiokinesiotherapy, biofeedback, and electrostimulation. As I said, vestibulitis is very often affects women of childbearing age. Which symptoms that affect the quality of daily life? I think that a treatment without pain, a simple treatment like oxygenal therapy is very important for this type of pathology and for young women in particular. The literature to date does not offer as many solutions to this therapy. But considering the causes and the manifestation of the symptoms of this pathology, I decided to undertake this study to treat vestibulitis with oxygenal therapy. Since we know very well what the beneficial effect of oxygenal are. For example, biostimulation, we know that oxygen promotes the repair processes with the increasing of cellular metabolism, increases the synthesis of extracellular matrix, stimulates vascular neoformation. We know the very important properties of oxygen like anti-inflammatory, and for me it's very important in these particular pathologies like vestibulitis. And bactericide. We know that the frequently infection is one of the causes to vestibulitis. Thanks to literature, we know that the oxygenal therapy is a good treatment for the ulcers, for example, for the repair the skin. The first approach in the genital area is for genital urinary syndrome, like symptoms like vaginal dryness, pain during intercourse, vaginal burning, itching, recurring cystitis. That I think that is the same, is very similar to our pathology, vestibular pathology. We know that the improvement of these symptoms like burning, itches, pain is very good in the session, the first, second, third, and fourth session. We use the hyaluronic acid in it because we know the most important effect of hyaluronic acid in the mucosa, in the vaginal mucosa, in the vaginal tissue. The vaginal mucosa regeneration. The protocol that we use for this study is 5 minutes in the first phases with oxygenal and hyaluronic acid external at the vulva. And the second part of the protocol in the second phases is internal in the vagina with cannula, 10 minutes only with oxygen, and in the third phase 5 minutes with hyaluronic acid and oxygen. We use the airbrush for the external treatment, and we used the cannula for the second part for the vagina treatment. In the third phase, we can show the hyaluronic acid in a solution. The result is very, very good. We have in the first part of the study considered different items like pH, dyspareunia, dryness, itching, burning, and elasticity. After 5 sessions, we know and we show in this result that all these items are better. The patients are very, very happy for the results. We are collecting the follow-up after 1 year, but I can tell you that the patient after 10, 11 months are very happy, the symptoms are good, the patients stay very good, the quality of life and the quality of sex are good.